Hello everyone, our today's topic is acute infection sciences fistula. So here we shall be first discussing about cellulitis. What is cellulitis? Cellulitis, it is a deep infection of the skin, usually caused by the bacteria. So it can affect the arms and legs. It can also develop around the eyes, mouth. So why does cellulitis affect? Normal skin can be affected by cellulitis. It usually happens after some type of injury that causes a skin break, including the trauma or surgery. So when the skin breaks, the bacteria can easily enter and hence it can cause infection. Now what causes cellulitis? Cellulitis, it is usually caused when the bacteria will enter the wound or area where there is no skin. So the most common bacteria that causes cellulitis is the beta hemolytic streptococcus. So the cellulitis, it is a subcutaneous inflammation that is caused by hemolytic streptococcus. The streptococcus will produce hyaluronidase and streptokinase. So due to this, the inflammatory exudate, it will spread in the subcutaneous and facial planes that will result in the swelling of the affected part. Now what are the sources of infection? The sources could be injuries that are minor or major injuries, the precipitating factors. A diabetic patient has more chances of getting cellulitis because there is a patient with a low resistance. What are the most common sites affected? The most common sites affected are the lower limb, face and scrotum. So what would be the clinical features? Once the bacteria it enters the subcutaneous tissue, the affected part would show inflammation. That is redness and itching, followed by diffuse swelling. The skin would be stretched and shiny. There would be pain, fever. So what is the difference between the cellulitis and abscess? In the cellulitis, since it is a diffuse swelling, whereas the abscess, it is well circumscribed and it has an edge, whereas the cellulitis, it has no limit, no pus and no fluctuation can be seen. In abscess, pus is seen, fluctuation test is positive. So you would see on the clinical examination, there would be redness of skin, swelling of the skin, tenderness, pain, blisters, fever, headache, chills, weakness. So how is the cellulitis diagnosed? The diagnosis is usually based on the medical history and the physical examination. What you can do is take the blood and the skin sample to confirm the diagnosis and the type of bacteria that is present. A bacteria culture test can identify the organism causing the condition and hence the proper antibiotic could be given. So what is the treatment? As we know that since the cellulitis would cause edema of the leg, so the patient should take a bed rest with the legs elevated. So that would reduce the edema of the legs. So if the patient is suffering from diabetic mellitus, it can be treated with injection insulin that can be given subcutaneously. Antibiotics can be given, crystalline penicillin in either intramuscular or intravenous dose could be given. So to prevent cellulitis, use good personal hygiene, wash hand often, apply lotion to dry cracked skin, use gloves when cut and scrapes may happen. So if the skin breaks happen, keep the area clean and over the counter antibiotic ointment can be used. What could be the complication? The cellulitis, it can turn into abscess that that could be drained out by giving incision. Second, necrotizing fasciitis. Certain high invasive strain of the Streptococcus pyogenes can cause extensive necrosis of the skin and the subcutaneous tissue that results in necrotizing fasciitis. It is treated by debridement and skin grafting could be given later on. Cellulitis, it can also precipitate ketoacidosis in patients who have diabetic mellitus. Other is the Ludwig angina. What is Ludwig angina? It is a form of severe cellulitis of the floor of mouth and has a bilateral involvement. It involves the submandibular space, sublingual and the submental space. So remember, it involves three spaces: submandibular, sublingual and submental. It presents with acute onset and it spreads very rapidly. So early diagnosis and immediate treatment planning is vital. What are the precipitating factors? Remember the word C. Number 1, the caries tooth, the cancer of oral cavity, calculus in the submandibular gland, chemotherapy, or chronic disease like diabetic. So what are the clinical features? There is oedema of the floor of the mouth, due to which this tongue is pushed upward, so that results in difficulty in the swallowing. So patient will present with a high grade fever. A halitosis could be a characteristic feature, is the characteristic feature of the disease. So how can you diagnose it? It can be diagnosed with a dental X-ray or CT scan of the neck that can be used to identify the deep neck space infection. A culture sample is collected as the Ludwig angina. It is often polymicrobial and anaerobic. So the microbes are the virulent streptococci, staphylococci. So the first treatment is to maintain the airway. So airway compromise is known to be the major cause of death from the Ludwig angina. So allow the patient to sit in an upright position with supplemental oxygen that can be provided by the mask. If the nasotracheal intubation it is not possible, cricothyrotomy and tracheostomy under LA can be done. So beta lactamase inhibitors like amoxicillin, ticarcillin with clavulanic acid or beta lactamase resistance antibiotic can be given like cefuroxime, imipenem, meropenem. So they should be given in combination with drugs against the anaerobes such as clindamycin or the metronidazole. The best treatment is surgical incision and drainage. The other is lymphangitis. What is lymphangitis? Lymphangitis means the inflammation or an infection of the lymphatic channels. So what are the main organisms causing lymphangitis? It is the Streptococcus pyogenes. Sometimes fungus may be involved. That is sporothrix. Sporothrix fungus is related to the lymphangitis. So Streptococcus pyogenes, hemolytic streptococci, they are involved in the etiology of the lymphangitis. Lymphangitis is sometimes called blood poisoning. As we know that the lymphatic vessels, they are smaller than the capillaries. So these vessels, they are fitted with valves to direct the flow in only one direction. So these lymphatic vessels can uh, uh, here the fluid rich in protein, minerals and other substance can travel along with transport of cancer cells, damaged cells, bacteria and the viruses. So the infection spread out of the wound site to enter the lymphatic system. So after the infection, what you will see, the lymph nodes would enlarge and there will be appearance of red streak in the skin along the direction of the regional lymph nodes. Now what are the signs and symptoms? First of all, the skin is warm over the site of infection. The patients will have chills, high fever along with infection. The red streaks can be clearly demarcated in the peak. So in order to diagnose the infectious agent, either strepto or staphylo, blood culture test can be done. The treatment, the wound should be treated properly. Dead tissue should be removed from the wound site. You can apply heat to the affected lymph node using hot compresses or heating pad. Also, for the streptococci stain, antibiotics like cephalosporin, cephalexin can be given. Methicillin resistance Staphylococcus aureus, it is common, and you can give trimethoprim sulfamethoxazole combination in that case. What is an abscess? Abscess is the localized collection of the pus. So it will contain dead and dying neutrophils with the proteinaceous exudate. Now we can classify the abscess into either it can be pyogenic, it can be pyemic or cold abscess. The pyogenic abscess, it is the most common form of abscess. It refers to the soft tissue abscess. Pyemic abscess is due to that is circulating in the blood due to the pyemic emboli in the blood. Third is the cold abscess. It is due to the tuberculous abscess due to the involvement of the lymph node. Now the pyogenic abscess is produced due to the infection due to the staphylococcus. The organism will enter the soft tissue through an external wound. It can be either due to also cellulitis. So what you will see is the pus that is composed of dead leukocytes, bacteria and the necrotic tissue. The patient will feel throbbing pain at the site. What are the signs and symptoms? There is calor, that is production of heat. The affected part is warmer due to the rise in temperature. Calor, rubor, dolor, tumor. Rubor is the redness, dolor means pain, tumor means swelling. Fifth is the loss of the function. The treatment is incision and drainage that can be either done in the GA or LA. The procedure, you can give a stab incision. What is the stab incision? It is the incision that is made on the most prominent, that is the most pointing part of the abscess. So when incision is made, the pus will come out and it is sent for the culture and sensitivity. The antibiotic that is given is the cloxacillin for the staphylococcus abscess. What is modified Hilton method? So when the abscess it is situated in near the important anatomical structures like the vessels or nerves, in such conditions we do a Hilton method. In this, the superficial fascia is incised instead of the stab incision, followed by the opening of abscess by the sinus forceps. So the sinus forceps is taken within the pus cavity and all the loculi are the broken down. So that will prevent the vital structures like the vessels and the nerves. What is antibioma? Important is the antibioma. It is the antibiotic induced swelling. So once the abscess is formed, if the antibiotics are given, they seldom do a cure, but the pus, it will get partially sterilized. So what you will see is there would be fibrosis and thickening of the abscess wall that results in hard lump. So that is antibioma. The site of antibioma are the breast, thighs, etc. What is pyemic abscess? It is the pus. It is due to the pus producing organism that is in the circulation. It commonly occurs in the diabetic patient receiving chemotherapy or radiotherapy. Other is the cold abscess. Cold abscess is due to the chronic diseases like tuberculosis. Why it is named as cold abscess? Because it is abscess which has no sign of inflammation. The causes of the cold abscess are tuberculosis, actinomycosis, leprosy or Madura foot. So remember the cause of the cold abscess. Other is the cervical tuberculosis lymphadenitis. Lymph node tuberculosis, it occurs in 20 to 40% of the extrapulmonary tuberculosis. It is due to the Mycobacterium tuberculosis. So here the Mycobacterium it passes through the tonsillar crypts and affect the tonsillar nodes or the jugulo-digastric group of nodes. Now, what are the stages of the tuberculous lymphadenitis? The first stage is the stage of the lymphadenitis. Here what you will see is the discrete, mobile, firm lymph nodes that are palpable. It is condition that is seen in young adult between 20 to 30 years of age. The second stage is stage of periadenitis or stage of matting. So the lymph nodes, they will move together. It results due to the involvement of capsule. So the lymph nodes here would move together and results in matting. The third stage is stage of the cold abscess. It occurs due to the chisating necrosis of lymph node. That results in the fluctuant swelling in the neck. So there is a fluctuant swelling in neck. The clinical features are there is no tenderness, no redness. The fluctuant swelling could be seen. However, the transillumination test will be negative. The fourth stage is stage of the collar stud abscess. So when the cold abscess that is deep to the deep fascia, it ruptures and forms another swelling in the subcutaneous plane. That is known as stage of collar stud abscess. And last stage is the stage of sinuses. Sinus, it is a blind tract leading from the surface down into the tissue. It occurs when the collar stud abscess rupture throughout the skin. Now, what are the investigation you can do in the tubercular lymphadenitis? One can take blood picture that will reveal low hemoglobin. ESR will be elevated. The chest X-ray is negative. Also, sputum test can be done for acid-fast bacilli. And we can do fine needle aspiration cytology. What is the treatment? The treatment is the anti-tubercular treatment for the lymphatic tuberculosis. The 3 drugs regimen, rifampicin, pyrazinamide, that is given HRZ for 2 months. So these are the dosage. Boil. The other name of boil is furuncle. So remember, it is a hair foil infection that is caused due to the S. aureus So what you will see here is there is painful indurated swelling with surrounding oedema. In 1 to 2 days, a pustule will develop that will burst, discharging the pus. The treatment consists of incision and drainage. Antibiotic cloxacillin is the treatment of the choice. What is carbuncle? It is an infective gangrene of the subcutaneous tissue that is caused by Staphylococcus aureus, common in the diabetic patient. The most common site of carbuncle is nape of neck, back and the shoulder. So what you would see here is there will be abscess. So these abscess would be intercommunicating and they have a multiple opening like sieve like opening. So this is the sieve like opening that gives a cribiform like appearance. That is the pathognomic of the carbuncle. The patient will be diabetic, swelling in the nape of neck. The surface is red, looking like red hot coal. The treatment insulin is the choice. Parenteral antibiotic can be given. For methicillin resistant Staphylococcus aureus, vancomycin can be given. The surgery is required when there is pus. Cruciate incision is preferred because of multiple abscess. Erysipelas. So it is an acute inflammation of skin and subcutaneous tissue. The organism here is S. pyogenes. So it has appearance of rose pink rash. The rash is rose pink with a raised edge. When it occurs in the face, it involves the pinna because it is a cutaneous. It is a cuticular lymphangitis. It is described as Millian ear sign positive. So treatment is penicillin. What is necrotizing fasciitis? It is the spreading destructive infection of skin and the soft tissue including deep fascia, sparing the muscles. It is common in the lower extremities. So it is due to the beta hemolytic streptococci or a synergistic combination of anaerobes and non-group A streptococci. Patient would develop fever, jaundice, renal failure, sudden pain in the affected area with gross swelling of the limbs. Treatment is the hospitalization. Vancomycin with carbapenem may be given. Penicillin can be drug of choice. Clindamycin also can be given. Localized area of suppuration within the striated muscle is pyomyositis.